This is an innovative change to the design of ureteric stents that has a huge impact.
The ureter, and you've got two of them, is a tube that carries urine that's made in the kidney into the bladder where it gets stored. We use a stent when the ureter has been damaged or maybe compressed from outside, possibly due to a tumour. When a stent is in the body, crystals start forming on the inside and outside of the stent due to chemicals in the urine settling on them. They block up, they stop working. That can cause pain and discomfort. It can cause blood in the urine, and you have to remove them, and that's bad if you have to remove them prematurely. So a cancer patient might need a stent for up to 5 years, and every 3 to 4 months they'd need a general anaesthetic to replace it with a new one. Over the course of your cancer treatment, that's 20 procedures you're having?
This problem is massive. What is it that is leading the stents to fail so often? A lot of companies have tried to address this problem by introducing new materials and designs. However, still these problems exist. Stent's design has got holes that are punched throughout the length of the stent to enable the fluid to travel around the obstruction without leading to reflux. If we don't address the drainage, all the waste can go into the bloodstream, and eventually it could cause urinary tract infection or even death. During my research, I found out the current side holes are not appropriately designed. They are becoming stagnant regions that particles starting to stick together and lead to crystallization. So these stents get blocked themselves. We started to look into improving the design of these side holes. Being at the University of Southampton put me at a very unique position. I engaged with chemists, clinicians, microbiologists, engineers, and even was exposed to the Formula One team's knowledge about fluid flow and used the same concept in improving the performance of the side holes. Our innovation is a tapered design for the urine to travel much smoother and reduce the stagnation of particles. If we could reduce the stent replacement frequency to once a year, that would be a huge achievement.
This is potentially going to be transformative for cancer patients. The other common use for ureteric stents is in the management of renal stones. Then we're looking at potentially 100,000 patients a year who might benefit. That might save the NHS in excess of £100 million a year.
Patients don't have to deal with so much pain, and there are hundreds of thousands of patients around the globe that would benefit from this innovation.